At the end of summer, we were seeing decreased volumes. The pandemic was a little more under control. And now with the second wave that's coming, we're seeing a lot more patients. So we're seeing, in the fall, 1 to 2 new patients a week. And I think this week we're at 15 new patients this week. The age range is very large. This morning we're getting referrals for pediatric patients and then patients all the way up into their 70s. I would say that 10 to 30% of patients are going to have one of those domains affected at 3 months. What we're going to know as time goes on is how many people are affected at a year or 2 years or 5 years. We initially set this clinic up thinking of it as kind of a post-ARDS, post-ICU clinic. And in those populations, there are domains that are affected, and that includes your physical domain, so your endurance. There's the cognitive domain, so how you think, can you manage your money, can you remember your task, where your keys are, or how to get home from work, things like that. And then there's the mental health domain. So are you feeling anxiety, depression, PTSD? And all of those things can be affected in ICU stays. I think what we're finding in COVID is it's not just the ICU patients that are affected in those ways. We're thinking that multiple systems are now affected. And as the literature comes out, we're seeing that myopathies and cardiomyopathies are more common than maybe we initially thought. And we're also seeing that the cognitive impairments are probably more prominent in patients that really were never hospitalized. In some of the patients with cognitive complaints, we're beginning to trial some medications which have helped with cognition in other populations like concussion or stroke, and seeing if that is a benefit in this group. I think another thing that we've learned is that initially we thought that the young were relatively spared and that this was a disease that was affecting people with comorbidities and older age. And clearly those people are at greater risk, but it's not that the younger people are completely spared. I think we're going to have a lot more infections, and even if it's only 5% of the infections that have long-term effects, it's a massive public health issue. My hope is that most people recover fully, but we may be dealing with a group of patients who has more long-term effects, not just 3 months, but a year or 5 years or indefinite effects. And we really want to be here to serve those patients and help rebuild life in whatever way we can for those patients.